Welcome to BackWords. We're here tonight in Plymouth, Wisconsin. I'm Dr. Dan Francis. Our show tonight is again on health and wellness, and our topic is core strength. I'm going to go right to the spine. As we are dealing with spinal core, this is, as a chiropractor, really our main thrust. Most people come in with spinal-related issues. And I'm going to break our show into a couple segments. I'm going to first talk a little bit about the spinal core and how it works. Got a couple props to talk about that. And then after we're done talking about the spine and the core, what we're going to try to do is bring in a gal who's going to show us the exercises that I use in my practice to strengthen the core. They call it the core. It's the trunk. It's like a limb, like a tree. If you don't have a strong trunk, you're not going to have any stability for the limbs out on the tree. Say central stability gives core mobility, lets the limbs move. And that's very, very true. Most of the people that I treat who have back problems have some kind of core issue. And if they don't stabilize their core, I can treat them, make them feel better, but they're going to come back in. And it's not going to get better. So we really need an active participant, and that's what we're trying to do on this show, is empower you to take control over some of your health. So here's the human spine. You have the pelvis disassociated from it. You've got the cervical vertebra, which is the neck, 7 vertebrae there. The thoracic vertebra are 12 vertebrae in the mid-back, and if you feel that hump in the back, that's the thoracic vertebra. Thoracic vertebra are where the ribs attach to and form the rib cage. Below that, you've got the lumbar vertebra, and there's 5 of the lumbar vertebra. That's the low back. And then the ending of the spinal column is a wedge-shaped vertebra called the sacrum and the coccyx. If you notice from the side, you've got a curve, inward curve, outward curve, inward curve, outward curve. They call those the lordosis, or the inward curves, and the outward curves are called kyphoses. They act like a shock absorber, a spring. Okay, and under proper posture, the spine holds the weight up. Okay, you really don't need a lot of muscular contraction when you're standing properly. The main muscle that contracts when you're standing in upright posture is the calf muscle. With that head, which is the weight of a bowling ball up here, when that goes forward, well, then you start to, now your muscles in your spine, they have to hold you up, and it's very inefficient energy. And if the head goes that way, it really throws off everything below. And that's something you can do at home. If you feel the small of your back, the vertebra, the bone right here, called the spinous process, if you flex your head all the way down, you'll see that actually moves. These things are all connected in here. When someone comes in, I can't treat just their neck, just their mid-back, just their low back, and expect that it's going to improve very much if I don't treat the whole unit, because we don't operate like this is a separate muffler and a separate wheel. They all work together. So that's those spines act like a very strong spring. The way the vertebrae are shaped allow for certain motions within the spine. So in the mid-back, you can rotate quite well. In the low back, there's not a lot of rotation, but you can flex and extend. And the discs are the cushions within the spine. So the whole idea of core strength is to keep the spine stable. And when you're doing that, the pelvis is very important in that, because the pelvis is how the spine is going to sit and then distribute on into the legs. And a lot of the muscles of the core actually attach into the pelvic area. So there's a couple main components of the core. There's the front plate and the posterior plate. So your posterior plate, if we're looking at the human musculature, is the spinal back straps. Okay, long, slender muscles. They're basically thousands of muscles actually that attach from each individual vertebra on a bunch of little different points. They literally go up and over this way, and they crisscross back and forth, forming what looks like one muscle, but it's actually thousands of muscles. Their main job is to stabilize. Your back is not meant to lift. That's what God gave us this for, the big old glute. That's the power muscles. The back is meant to keep the core strong. Then you have the front plate, which is what we call a six-pack. That's the beach muscle. I don't have it anymore, but that's the beach muscle. And you can see the outlines, okay? And that's the front plate. That attaches from the lower ribs all the way down. So that attaches all the way from the lower ribs all the way down right until the pubic symphysis right here. Okay, that's a straight plate. And those two are the areas that most people focus on. And the problem with that is without doing the side muscles, which are the external obliques, you're not tying the whole core together. And that's where a lot of problems run in, because if you don't have these oblique muscles, which attach around to the spine, they engulf it. That's what gives you your natural back brace. When someone says, I'd like to use a back brace, I don't want them to do that, because if you use a back brace on your spinal muscles go on vacation and they weaken and they atrophy. What we want you to do is engage this core, stabilize it so it's alive and well for you. Now, a lot of back pain core muscles, and I'm going to show you this sign or this picture here. This is an MRI from a woman who is very lean. It is a cross section. So what we have here is we took a vertebra out of the spine, and they did an MRI, and they cross-sectioned it so it's cut through like this. This is the back of the spine, this is the vertebra. And when we look, she has chronic back pain, and she thought she was surgical. She did an MRI, and this is the vertebra right here. So the vertebral body is sitting right here, okay? And this is her back, okay? These two spots right there, those are the back straps cut in half. So if this were steak, that'd be like a T-bone, right? The vertebral body, the bone here, the bone here. Here's the back strap. That looks like red, nice lean venison meat. That's good, strong muscle. That was up in her upper back where she's not having a problem. Now, when we look at her low back where she's having her problem, this is that same area. And again, I mentioned that she was a lean woman because this is fat. That white in there is all fat on an MRI, which indicates a lot of water. There's no muscle mass down there. And as a result, she's got a lot of weakness. So she wasn't a surgical candidate, fortunately. She had a lot of weakness in her spinal muscles, and that allowed for the spine to just shift and move around, and that is just very uncomfortable. So our whole gist is going to be to stabilize the core. And so we're going to have Brenda come on in, and we're going to show you a few exercises. Take a short break, go back to a few more exercises. So I'm going to have you kneel down. We're going to go through those exercises I call the 5 rights. And go kneel for me first. And I'm going to have you do the head flexion. That's perfect. And then extend back up. This is called the cat camel. This draws extension into the spine. It's a yoga move. And this is beautiful because when she is arching up, she feels that in her abdominal muscles, okay? And when she extends up, now she's contracting her low back muscles. And you're getting the balanced flow. You're getting the extension on one end, and then you're getting the flexion on the other. So we're stretching this part, we're contracting this part. It's a perfect exercise to loosen up the spine. They use this for nerve issues. They call it spinal flossing. It moves the spinal cord back in and out. And you notice, because what I told you before, with that nerve or with that everything connected in here, when she goes down, we use her neck also. While this is important for the low back, it builds flexibility and strength within the neck. Okay, so that's the cat camel. It's a great exercise, and that's one of the best yoga exercises there is. I use this for patients who are in a lot of pain because they can mediate how deep they go into it, and it's a real nice way to break in routine. So why don't you go on your back for me? I'm going to have you do the knee flexion to chest. Why don't you do perfect? And straighten those out. This exercise is in replace of double straight leg raise. We're going to strengthen the core, and we're also going to get some hamstring flexibility developed. So I'm going to have Brenda put her hands overlapped like so under her back. That protects the arch of the back. And what I'm going to have her do is draw her knees to her chest, bending them. Perfect. Now what that's doing is when she does that, go back down again. When she does that, she's getting her lower abdominal core. When you do crunches, you get up here. When you do this exercise, you're getting that lower abdominal core, which is really where it concentrates and connects. So go ahead, you can start that over. And then when she comes up here, I'm going to have her release and stretch. Now she's a great athlete, so she's very straight here. Most of my patients are not. They will be like this. At that point, this is correct for them because they're getting a stretch here. What I don't want out of you is this, because you feel that in your back. And that's not what we're looking for. We do not want any strain on the back at all. So with this exercise, the hands also help, because when you roll over, that tilts the whole pelvis forward. And that takes the pressure off of the hamstring, or off of the low back. It allows you to get the stretch in the hamstring. And that hamstring attaches in. Now you can drop down. And you put them all the way down, and then I like to have people drop their hips out and roll them back. That gives good hip mobility. The hip is part of the core. It's a main stabilizer in holding up the whole pelvis. So that, go do that again all the way through. Nice and easy. You pause and you go back down. Drop them all the way. There you go. So none of the exercises I have, or these first few, are hold exercises. You do repetitions. You're back and forth, and that breaks up muscle spasm. It draws blood flow. You're getting a contraction on one end and a strengthening on the other, and that ends up being the perfect balance, because core is not just about strength. If you don't have flexibility, you're not going to have any strength, and that's a big issue. So why don't we do the table? Okay. I'm going to have you put your legs straight out and put your hands right by your hip, and just flex your head forward and extend your head back, and now bridge up to a table. That's a tough move. This is the toughest exercise I have patients do. It takes a lot of core strength. It takes a lot of shoulder flexibility. She does it perfect. You can come back down. So do that again, just up and down. And slide. I want you to slide all the way back. So the whole move should keep your feet stable. So put those straight out. Yep, and go up. And down. And slide your butt all the way to your hands. That's it. That's perfect. Is your legs flat? Perfect. Good. We're going to take a break. When we come back, we're going to show you some more exercises that will help stabilize your core. We're talking osteoporosis and bone health today. This is a walrus bone. It's a little bigger, so you get a good view. And you can see the trabecula, or the honeycombing, that gives you the strength. What we want to prevent in people is osteoporosis, which is the thinning and the weakening of this bone. And you lose the strength of the cortex. Now, this doesn't show the cortex because it's fossilized, but when you're eating proper nutrition, your bone health is going to stay better and more strong. Now, what we want to do is we want you eating vegetables like the cruciferous vegetables, broccoli, kale, Brussels sprouts, cauliflower. Those actually have a ton of bone-building nutrients in them, as well as dairy. Ton of bone-building nutrients in them. The other thing we want you to do is we want you staying active with walking and running and jumping and bicycling. You want to stay active, because if your body is using it, you won't lose it. And that's the most important part of keeping a strong skeleton. We'll be right back. Welcome back to Back Talk. We're here with Brenda. We're going to show you some more core exercises, and we're going to go through the table one more time. I'm going to have Brenda flatten her legs out. And then one thing I want you to do is, and this is a hard exercise, and we're going to show you an easier version in a second if you can't perform it. But when you do this, the true proper way, you come up without moving your feet. Go ahead. To the table, you pause, and now you go down, sliding your butt all the way down. And this is a very hard exercise. Most people feel it in the shoulders. That's usually the limiting factor for them. And people with a real weak core will look like an old bear, sort of hunched in the middle. And that's okay. If you can't do it, it's usually a sign that you need to do it and gradually progress. All of these exercises, these first 4, I actually recommend people do only 5 repetitions. And because they're nonstop, 5 repetitions of these take about 3 minutes. And that's important. I'll have them, I'm much more interested in a person getting the habit formed than getting help right away. Because if they don't form the habit, they're not going to get any help in these exercises. So for the first 3 weeks, I have them just try to give me 3 minutes a day. It cuts down excuses on that I don't have enough time to do it either. So what we're going to have Brenda do now is lie on her back, and we're going to do the easy version of the table, which is the bridge. And in this, she's just going to lay her hands down. She's going to bridge up, hold for a count or 2, and then come back down. Again, this is a great exercise for the abdominal plate. Okay, go right ahead. See the pelvis thrust up, and she's getting a stretch in the back and also a contraction within the gluteal muscles, a little bit within the thigh. It's just perfect. You notice how she's nice and relaxed. You know, she's not straining when she does that. That's perfect. That's a perfect rhythm. So that's good. Now we're going to go to the 4th and final exercise of this set. And that is the upward dog, downward dog. Again, a yoga-based exercise. And again, it's working the front half and the back half. If there was one exercise, if a patient said, I will give you 1 minute a day, this is the exercise that I would do. And I'm going to have you move up a little bit. Yeah. Perfect. And now go into the upward dog. This is the downward dog. And now the upward dog is the up portion. Now I'm going to critique Brenda here. The true way to do this is to try not to shuffle your hands. Okay, so from here, go right into the up dog or down dog position. That's perfect. And now go back again. Good. Now, you can rest for a second sort of in that cobra pose. When you look at Brenda's hands, if you want to save your wrists, which you do, you can rest. Totally, sorry. What you want to do in this pose is you want to keep your index finger sort of pointed straight ahead. Okay? You don't want your hands all cockeyed because that affects your arms. You also don't want them set offset. Keep that index finger pointed forward. That'll keep your hands in a power mode. The other thing you want to do is you want to protect your wrist. And that's simple enough. By lightly contracting, you don't have to try to do a finger push-up. Just lightly engage your fingers so you see a little blanching in there. And that stabilizes and protects your wrist. And then you lock your elbows. This exercise actually is a shoulder exercise. It's not guys make this prolonged push-up and they just make it brutal. It should be a real easy flowing. Why don't you do a few back and forth. And keep your hands just a hair closer together. Perfect. And just go back and forth. When she gets up this upside, she's stretching her groin, her abdominal plate. Now she's contracting her stomach to get here. She's getting the whole posterior of her leg, her gastroc, her hamstring, her glute, even getting the arch. This is a great exercise for people with plantar fasciitis. You're getting the whole shoulder girdle. 1 minute of this does you just wonders. And by doing it back and forth, it just gives you a contraction so it actually feels like you warm up. It's a great, great exercise. My favorite one. And it is really a main staple in I think any yoga routine. And we'll have a show on yoga later because it should be in everyone's routine. That's great. You did great. Now let's do the easier version of that. Some folks just can't do that. Oddly enough, Brenda's going to do that one easier than the easier version because she has a knee issue. But this is, now we're going to have her do the cobra. Now the difference is I'm going to have you rest your whole body on the ground. Okay. And now come up. And you can see the difference here between cobra is she's bearing weight on the ground. She's not elevated like she is in the down dog. So that makes this one a little easier. It's a little less burden on the shoulders. Mm-hmm. Now she's going to go from here to child's pose. So it's a squat position. She bows her leg out a little bit because she's got a bad knee, and then just back and forth. Great. And this too, it gives you great spinal flexibility, stretches the shoulder, strengthens the shoulder on the other end, gets that front groin, which is often neglected, especially in sitting jobs. It works marvelously. That's great. That's wonderful. So what we're going to do now is transfer out. Those are the four main staples. There's a few more in there because we showed you some easy versions. Right now we're going to go to more strength poses. These strength poses are different. They are not movement-based poses. They are basically taking your spine and trying to hold them and stabilize them. Because these core muscles, they're not big movement muscles. Okay, that's for the glutes. These core muscles are actually muscles that are just meant to hold steady. And we want to hold steady, so we're going to do long, steady holds. When you first start these, let's do the plank.
On the arm or on the
You can do it either way. We're going to show both ways. Do the regular plank first.
Oh. Okay.
Yeah. So this is the plank. And there's two ways to do the plank. So this looks like a pre-push-up. It's one of the reasons why push-ups are such great exercises, because they strengthen your core. Every time you're doing a rep, she has to tighten this whole belt around her core. So her buttocks is contracting, her oblique muscles are contracting, that anterior plate, all these core muscles back here, and she just holds it. That's all it is. You just get up there and hold it. This is tougher on the shoulders, so you're strengthening the shoulders also, which is great. Another version of this is to do this, but on your elbows. Okay, go ahead and show that. That's exactly how I do it, sort of put my hands to a prayer, and that's great. You can see now you're not quite as in a tilted posture. You're a little more level, and she's rock solid. And the idea is to hold this as long as you can for a minute or two. A person that can hold this a minute or two rarely needs to see me. Okay, they're usually pretty solid. That's good. Now, on that note, I had a young fellow who came in. His body was an Adonis. He was chiseled stone, and but he had chronic low back pain. Young football player, had MRIs, all that stuff, and it didn't go anywhere. And we realized that his problem was his oblique muscles. He could hold this plank forever. He could hold the next exercise, the Superman, forever, but he couldn't do the side plank, so his muscles weren't talking to each other. As soon as he strengthened that, he was great. So let's show the side plank.
Side plank?
Yeah. Now the side plank is geared at getting these oblique muscles. That's perfect. And Brenda's perfect here. She's nice and level. If you do the side plank and you find that you're rotating forward like this, that's because you're recruiting your six-pack, and that means your obliques are really weak. So you really have to make sure you're stable like that. Now do it on your elbow. These are hard exercises. So most people who start this aren't going to be able to hold this for a minute or half a minute. So if all you can hold it for is 5 seconds, do that and do a few repetitions of it. The other way to do the plank and the side plank is to cut it short by staying on your knee. So do it just from the knee up. Yep. This makes it a lot easier. And when you do that, that shortens the lever, so it's a little easier. You can decrease how long you're doing it. This is a good introductory method, and it works really well for strengthening those oblique muscles. That's perfect, Brenda. So, and that same method would be done for the regular plank. You would be doing, why don't you show that on your elbows and your knees, just a straight plank. Scoot over this way a little more, yeah. That's perfect. Yep, that's the easier version of the plank, okay? Now let's do Superman. You can lie on your belly. Superman is an extension exercise for the low back, and I'm going to first have you have your arms all the way down by your side. It's a progression. For someone who has a weak back, you're going to just extend your chest up off the ground. Now we're getting strengthening throughout the erector spinae or your back strap muscles. As you get stronger, you can add the legs in. Now you've got a boat shape here, okay? That gets the real lower core. It's excellent. Okay, same thing as the plank and the side plank. You're going to hold this. You try to hold this as long as you can. Now the next level would be to bring your hands up by your ears, okay? Now that throwing a little more weight towards your back. Now you can bring both up again. And now you can do Superman as the main Superman. Let her fly. Go. Perfect. That's the longest lever, so that's the hardest way. You hold this a minute, really strong low back. So that's great. Good job. All right. Now from there, we're going to go to an exercise called the dead bug. Everybody have Brenda lie on her back? This exercise is an exercise that helps stabilize the core. It's really meant for the oblique muscles. So I'm going to have Brenda bend both of her legs right here. They're sort of at a square angle. She's going to hold them. Now I want her oblique muscles to be tight. I want her to feel those muscles. I want you to contract your belly like someone was going to punch you, okay? Right in the side. And when they get toned like that, I want you to hold it. I want you to touch your heel to the ground and come back up. This is a great and easy way to help stabilize those oblique muscles. You do 5 repetitions on each leg. It'll take you less than a minute. You do that a few times a day, and that works wonderfully. So that's great. I'm going to show you one exercise on the ball. It's called sit to bridge. So you can sit right on the ball. These exercises, we'll have to come back and do more because we're running out of time, but the stability balls are great. I highly advocate using them. It's a $10 to $12 tool. But I show other exercises first because sometimes you just don't have a place or the area to do a ball. So all you need with all those other exercises is your body in the ground. So this is a bridge again. So you just walk out to a bridge onto the upper back. That's it. And you walk right back up. This works the whole core, and it works it pretty darn good. And that actually is another point, is that when you come up, just go right up and sit and bounce. That exercise right there, just bouncing on the ball, every time you bounce, don't you feel your core engage? It's like a contraction every time. That simple exercise is a beautiful, beautiful tool. And it's a great way to stabilize your core. You can use that as a desk chair. Now, a lot of people do. Not necessarily all day, but that's it for us from BackWords today. I appreciate you coming, and until next time, we've got your back.